Hello, everyone, and welcome to our first FPN patient education webinar, Living Well with Peripheral Neuropathy. Today, we're going to be talking about managing the symptoms of peripheral neuropathy. I'm Nancy Froman with the Foundation for Peripheral Neuropathy, and I'll be your moderator for today. Before we begin, I want to go over a few housekeeping points. You can probably see the control panel on the right-hand corner of your screen. There are two very important things to note on this control panel. First, there is a tab that says audio. You are listening to this webinar automatically through your computer speaker system. If you're having trouble with the audio, or you would prefer to hear the audio through your telephone, you can click on the audio tab on the control panel and select telephone. You'll see a phone number to call to listen in on the webinar by phone and instructions to follow. If you're having other problems, feel free to send us an email or note in the question box. We have a couple of people on hand to assist you in getting back on. Secondly, talking about the question box, you'll see that there's a tab that says questions. You'll be able to submit your questions anytime during the webinar by typing your question in that question box of the control panel. We will collect these questions and answer as many of them as we can at the end of Dr. Patterson's presentation. Please make your questions general and not relating to your specific medical history. We're not able to answer individual medical situations or diagnoses. Finally, this webinar is being recorded. You will receive a follow-up email in the next day or so with a link to the recording so you can watch the webinar again. We will also have the video on our website so you can keep a watch for that as well. As I mentioned, I am Nancy and I'll be your moderator for today. I'm also joined by Lindsay Colbert, FBN's Executive Director, who will provide a summary and closing for us at the end of the webinar, as well as fielding some of our questions that you might have. And now to get us started, I would like to introduce Dr. Shanna Patterson. Dr. Patterson is Assistant Professor of Neurology at Mount Sinai West in New York City and serves as our FPN's Patient Education Advisor. Hi, Dr. Patterson, you ready to get started?
Hi, Nancy. Thank you so much. I certainly am.
Okay, I turn the stage over to you.
Thank you so much. I just wanted to say good afternoon to everyone. Thank you so much for joining us for this exciting kickoff webinar event. I hope that it will be helpful to all of you, and it is really an honor to be here and an honor and a pleasure to work with the Foundation for Peripheral Neuropathy for patient education. So the theme of this talk will be really living well with neuropathy. We know that in many cases there are some treatments, and in some cases treatments or cures are limited, but the goal of today's discussion will be to talk about how hopefully everyone or almost everyone can find ways to improve their day-to-day life. So just to start out with a basic kind of review of what we mean when we say neuropathy. Neuropathy is one of the most prevalent neurological conditions encountered by physicians of all specialties. And this means every type of peripheral neuropathy. In general, when you look at the population as a whole, one prevalence study estimated that about 2.4% of the population has peripheral neuropathy, but we do know that this increases with age. So when you look at the population that is age 55 or older, that prevalence increases to 8%. What I wanted to do was try to make this webinar a little bit more interactive if possible. So we'd like to do a poll, and starting out by just asking people to respond to the question, how is your neuropathy symptom control recently? Is it, for example, bad, meaning that you have a lot of problems on a day-to-day basis? Is it okay, but you feel like it could be better? Or is it very good? We're just going to let a little bit more time go by to allow some time for the responses to come in. And again, I would say I know each day can fluctuate, but if people are thinking about maybe taking a look back over the last month in general when you're responding to this question, that might be most helpful. All right, so we're going to take a look now at the results. And it's interesting to see that, unfortunately, not very many people at all felt that their symptom control was very good, and that it was about 40% of people felt that it was quite bad, and about 54% of people felt that their symptom control was so-so, but it could be better. So I think that this really is instructive because it also emphasizes that there's a humongous need really for looking at ways to improve how we can live each day to the fullest in the face of this chronic and often painful condition. Thank you all for your responses. What I want to again think about is, when we try to think about how we can improve something in our life, it's easiest to pivot to things that we can control or that we can really fix or, so to speak, cure when it comes to medical conditions. And it can be challenging, I think, to look at how can we make things better, even if we can't totally cure them. And so I'd like this quote from Coach John Wooden, who's a basketball coach, who said, "Never let the things you cannot do prevent you from doing the things you can." And that's again what I really want to focus on today, is thinking about, in the face of some things that we may not be able to control with respect to neuropathy, let's try to look and find as many things as possible that we can do something about or that we can change to see if it helps us feel better. Again, with the goal being to try to live each day to the fullest in the face of this chronic condition. One other thought-provoking question that I wanted to start off by asking is just to think about what are people's understandings in terms of what are the potential symptoms of peripheral neuropathy. So we have here some options, including weakness, pain, numbness, imbalance, or any or all of the above. Again, we're just going to let a few more seconds go by to allow for responses to come in. And then we'll be able to take a look and see what people think. And thank you all again so much for your participation. So again, indeed, the actual answer is any or all of the above. And I think that this response is actually really fascinating, because what we can see here is that a lot of individuals felt that it was weakness, pain, numbness, or imbalance. And I think, in fact, it is any or all of the above, but that for any one individual, for some people, it may be different. For some, the most problematic symptom may be numbness, but none of the others. Or, in fact, some patients present predominantly with trouble with balance, but that's really their primary symptom. Sometimes, of course, it can be pain or weakness, and some patients have a combination of symptoms. So some of the things that we're going to be discussing today really focus on pain or really focus on balance. And I think that as we look at the symptoms as a whole, hopefully, again, each of you will be able to find something that speaks to you and the symptoms that bother you the most. As we get started talking about our topic today, I wanted to just back up a little bit and take a look at why is it that we have, from an anatomic and physiologic perspective, why is it that we have so many different types of symptoms coming from peripheral neuropathy in particular. This image is actually a sort of expanded depiction of a peripheral nerve cut in half. This would be a large diameter myelinated peripheral nerve that might, for example, connect to one of your muscles or might be involved in sensation. So you can see here that the nerves are actually bundles of different small axons, which are then surrounded by myelin, and there are surrounding different layers of tissue that help protect everything and hold it together in one nerve unit, and also blood vessels that course through the nerve itself. And so depending on what type of axons are traveling in the affected nerves, that kind of demonstrates whether or not you have muscle or weakness involvement versus sensory involvement like numbness or pain. If it happens to be a nerve that carries both types of nerve fibers, you have both symptoms. Occasionally, patients only have a sensory neuropathy with no weakness whatsoever, and even more rare, patients who can have types of neuropathy where only the motor nerves or nerves that connect with muscles are affected, but their sensation is totally normal. Balance is a trickier topic because in order to have problems with balance, balance is such a complex entity with so many different factors that even problems with sensation or with strength can potentially cause trouble with balance. I also wanted to really take a moment at the beginning here to talk about autonomic symptoms related to peripheral neuropathy. This rather busy image here that you see is actually a drawing of what we call the autonomic nervous system. Sometimes we tend to think about neuropathy or our peripheral nerves in terms of the sensory nerves and motor nerves that I previously discussed. But in fact, there are many, many different nerves which are coursing through in your torso with your internal organs and in some other glands and even your eye itself. These are nerves that belong to the autonomic nervous system that help control a variety of different functions relating to our heart, our lungs, our digestion, our salivation, and so forth. And when these nerves are affected by peripheral neuropathy, which they sometimes can be, patients can also have a variety of autonomic symptoms. Now, what's interesting is that many patients actually underreport autonomic symptoms when they're talking to doctors about their neuropathy. And in a way, it's because it's not obvious all the time that these symptoms are actually connected. So some patients with peripheral neuropathy may also feel dizziness when they stand up, and that can actually be an autonomic cardiovascular manifestation from their neuropathy if those autonomic nerves are affected. Some patients can have symptoms that relate to the GI system like constipation, nausea, or diarrhea. Some patients have urogenital symptoms such as urinary bladder dysfunction or erectile dysfunction, or even changes in terms of the pattern of their sweating. And these, again, can be related to the peripheral neuropathy. For example, even in patients with diabetic neuropathy. Not every patient will have this, but I think it's important to think about because if you have been noticing that you're having a lot of these symptoms and there's no explanation for them, then it's possible that they may actually be an autonomic manifestation of your peripheral neuropathy. Sometimes it's easy to focus on how much we want to cure for our conditions. And I think that's very normal, and that always should be the goal. But sometimes it can be easy to lose sight of how important treating the symptoms really is. Even for patients who have so-called treatable neuropathies, commonly those patients have lingering symptoms from the neurogenic injury from the neuropathy itself. And so I think for every patient, treating the symptoms is important. And it's important not to lose sight of focusing on this in your discussions with your healthcare providers. And in some cases, as we know, where neuropathy is idiopathic, meaning we don't know the cause and we don't have a treatment for the underlying cause of neuropathy, then the management in those cases may entirely focus on helping with symptoms. And we also know, especially in cases where patients are in significant pain, this can lead to depression, anxiety, and problems with sleep. And so this can really easily balloon from what you might think of as a rather limited medical condition of peripheral neuropathy to really impacting many different aspects of your daily life and your ability to function properly and get a good night's rest. So again, it's essential, I think, to focus on the symptom management. It is in no way a peripheral part, no pun intended, of managing this condition. So let's start off and talk about what are some of the actual symptom treatment options. We're going to talk about a wide variety of things today, but let's just begin by talking about medication. So when people think about neuropathic pain medication, now just to be clear, neuropathic pain is an umbrella term that is a little broad. It encompasses all types of nerve-related pain. This includes peripheral neuropathy, but there are some patients who have neuropathic pain who don't have peripheral neuropathy. For example, pain following shingles is technically neuropathic pain, or rarely, patients who've had certain types of strokes can also have neuropathic pain or spine problems and so forth. But these are the medications. So we try to look at them in terms of which ones would we turn to first and which ones might we consider later down the road. Tier 1 is what we would consider first. What I think is really interesting, and you can see the breakdown here, you might say, well, geez, some of these medications say anticonvulsants, which means they're used to treat seizures. Some of these are antidepressants. What's interesting is that a lot of these neuropathic pain medications were initially designed not for treating neuropathic pain itself, but rather for treating other types of nerve disorders, for example, seizures or depression. And because nerve function really involves a lot of neurotransmitter or neurochemical modulation, it just happens that there's overlap and a benefit in pain control because these processes all have certain fundamental neurochemical or pharmacologic overlap. And so we found, for example, that the anticonvulsants or seizure medications, gabapentin and pregabalin, are actually effective in treating neuropathic pain. And I would say that actually now are almost more commonly used for treating pain than they are for seizures. Antidepressants, which are commonly used for treating neuropathic pain, may include things like duloxetine or amitriptyline. These are different antidepressants, again, which have been found to be effective in neuropathic pain. For some patients, just using something topically may be enough. And this can actually be a good option because not having to take a pill can be beneficial because you don't have as many, the risk of systemic side effects or interactions with other medications you may be taking. The lidocaine patch is one option, and this is actually essentially a numbing preparation. So it will not necessarily make your skin feel normal, but especially if you're having a lot of burning pain, and especially if it's over really a small area of your body where we can put a patch on it, then this might be a good option to try, or it could be a good option to try perhaps for breakthrough pain if you need something extra from time to time. Another type of topical treatment is actually called capsaicin. This is actually a derivative of a hot pepper. And in some cases, this can also have a side effect of causing like a chemical kind of discoloration or irritation or burning of the skin itself, which may not be for everyone. But again, this has been shown to be very effective for some patients, and it can be a good option. One thing that I like to think about when I'm first talking to patients is how, when we're thinking about medication, that is how can we sort of, so to speak, address two problems or kill two birds with one stone? So if a patient comes to me and says, I'm having a lot of trouble sleeping at night because of my neuropathy pain, I will personally often look toward a medication such as, for example, gabapentin, because gabapentin also happens to have a side effect of making people groggy, not all of the time, but it's a common side effect. And you can also choose to take the medication more in the evening rather than in the day, the rest of the day, especially if your symptoms are more focused at night. And so this may be a medicine that not only helps with the pain, but also has a side effect of helping patients sleep better at night. And to me, that's a win-win. For patients who happen to say, I've been feeling really kind of down because I have had so much pain, though I am for certain not a psychiatrist, I might say, well, let's use a nerve medication then, a nerve pain medication that not only will help your pain, but might also help your mood at the same time. And of course, for any patient with significant depression at all, we have to involve a mental health professional, but this can be something to consider for patients who are having other types of symptoms. There are other topical preparations, even medications such as gabapentin or another seizure medication called phenytoin have been found in topical preparations to be helpful for some patients for neuropathic pain. This is less broadly available, and you do need to work with a compounding pharmacy. This may be more expensive, but I just wanted to let people know that these can also be options, and again, may be particularly helpful for patients who rather exhaust all topical options rather than take oral medication. There are also medications such as ketamine, which is a little more extreme in terms of side effects and other controlled substance parameters that are out there as well in terms of topical treatment. There are other sort of tier 2 and tier 3, if you will, agents for patients where none of these previously mentioned options are effective. So for tier 2, this includes other types of antidepressant medications, actually known as venlafaxine. And then we start getting into opioid type of medications, including tramadol, or tier 3, tapentadol, and other opioids. You will note that opioids are not our first go-to. So for some patients who come to me and say, you know, I was seen in the ER or an urgent care and they prescribed me Percocet, and that really helped me, I'd like to continue that. It's actually the case, and it is legitimately the case, that this is not the best choice for chronic management of neuropathic pain. And so we will turn back and say, we need to try some of these other options first, because these are really the best long-term options, even though it might not be what the emergency room knows about or thinks about giving patients. And along those lines, I just wanted to actually mention, you might think, well, is this something that's up to individual providers, or is this something that is sort of privy to a lot of the political movement lately in terms of opioid prescribing? And while those may be factors, I just wanted to put out there for people who might be interested that the American Academy of Neurology, or the AAN, actually issues and looks at this very closely and issues position statements regarding the use of opioids for neurological patients, but including for neuropathic pain. So this is actually an excerpt from their actual published position statement. And we just wanted to I wanted to point out that actually we do see a benefit for, again, certain patients for using opioids, but for the vast majority of patients, we do have better options. And also the risks of opioid therapy for most chronic conditions in neurology outweigh the benefits. Another common question, so I didn't want to leave it out, is medicinal cannabis. This, as we know, is gaining a huge amount of press and attention in terms of applications across the medical world, including neurology and including peripheral neuropathy, with respect in particular to managing neuropathic pain. There are some studies, as mentioned here, that show some safety and efficacy for short-term low-dose cannabis vaporization and oral mucosal delivery for treatment of neuropathic pain. And sometimes I will say, you know, honestly, that I'll have patients who may not even be using medicinal cannabis, but more recreational cannabis, and will say that they found it to be helpful for them. And some patients will say that they don't find it to be helpful for them. Again, I want to pivot here and say that the American Academy of Neurology is also very, very closely looking at this, especially because there's so many different neurological potential applications for cannabis. One of the things that I wanted to just mention here, because I think it's interesting to be aware of, is that currently on a national basis, the classification of cannabis is such that it limits federal research dollars for research on medical cannabis. So a lot of the studies that we have come from other countries or have more restricted funding lines. And so there's actually a lack of scientific knowledge relative to what we would have if we had sort of opened the floodgates and changed the national categorization to facilitate more FDA funding for this research. A lot of physicians, and the AAN included, are really in favor of this. But at the time being, it gives us pause, because we have to say, we need to look very closely at the studies that are out there to see where did they come from, what were the environments they were being done in, and how can we rely on those, or not in some cases, to inform us about the patient population that we're working with. The other thing that I think is even more important, and again, not to dive into politics too much, but just to mention that there's a lot of limitations because medicinal cannabis is not legalized nationally. There's really a lack of standardization in terms of what are in the preparations. even though there's a lot of, at medicinal dispensaries, there's a lot of information about different CBD, THC ratios and so forth. Even with that being said, there's still a lot of variability that people are finding. And so it can make it even more challenging to say what exactly are you getting, or to be confident that from dispensary to dispensary or from state to state that you're getting the same type of medication that you might need for treatment of your condition, including for pain. So when I prescribe 300 milligrams of gabapentin, I know exactly what the patient's getting. I know exactly how to adjust the dosing. But when I'm treating a patient with medicinal cannabis, a lot of it's happening at the level of the dispensaries. I don't really know what exactly the preparations are. And then for patients, certainly, who are getting cannabis from other sources, there's a lot of variability that we're finding in terms of the content, and it can be harder, again, to standardize across the board. So I just wanted to make that, make people aware of that. That's not to take away from the value for any individual patient who finds benefit and who finds some good preparation that works for them and helps them. But I just wanted to make people aware, because I think that this gives some professionals pause, and we are all very, very hopeful that in the future there will be more research funding, and more standardization of medicinal cannabis products that will make it easier for us to prescribe effectively. So with that being said, I'd like to pivot now away from pharmacologic agents to non-pharmacological management of neuropathy symptoms. And one thing I want to mention as we start this discussion is that I will say that there are definitely patients who are really interested in holding off or minimizing pharmacologic treatment as much as possible. For sure, if you're having significant pain, it's important to use medication accordingly. But for a lot of patients that really find a lot of benefit, and are very interested in learning about all of the other approaches so that they can maximize those. And I think that's very, very important. So one quick thing, it wouldn't be a complete talk without at least mentioning nutrition and exercise, in particular for diabetic neuropathy, where maintaining a healthy and active lifestyle and diet can help control your diabetes, which can help prevent the progression or even allow for some improvement in the peripheral neuropathy from diabetes. Eating, again, whole foods, low fat, high fiber, ideally plant-based diet, and regular exercise, which can even involve walking for 30 minutes, 3 to 7 days a week. Maintaining close to normal glucose may reduce the incidence of diabetic neuropathy by up to 64%. And so this is something interesting and important to think about, I think, for all patients. Changing gears a little bit and looking at other specific types of exercise that have been studied with respect to neuropathy. Yoga has actually is relatively common. I think now we hear about this a lot in terms of the popularity of yoga across the board. But yoga has actually been evaluated in terms of looking at trials, looking at the benefits of yoga for patients with neuropathy. Some of these studies have shown improvements in diabetes. I don't think that yoga directly changes diabetes, but I think that it may. For example, if patients are spending time being physically active as opposed to perhaps being more sedentary, or eating more of the time, that certainly can help improve glycemic control. And a lot of these other measurements, including improved weight, reduced blood pressure, increased energy, and overall improved well-being, have also been found to be beneficial. One study, which I actually am not sure how to explain, but I wanted to mention it because it is interesting, showed that for patients who did yoga essentially daily for 40 days, for 30 to 40 minutes a day, there was improvement in nerve conduction velocities, which is part of the test for neuropathy. So this is obviously a very dramatic, result, and I'm not sure how reproducible it is, but it is out there. One piece of advice I wanted to give with respect to yoga is that there are many different styles of yoga, and some of them are extremely vigorous. Some of them are even potentially dangerous for patients. For example, there's some forms of yoga that are done in very hot conditions, which can increase the risk of fainting, especially for patients with certain medical conditions. I in no way encourage those unless you have the higher level of physical fitness, and that really is something that works for you. But I would advocate for some of the more gentle forms of yoga. And if you're ever unclear about anything, always speak to your medical provider first. Next, I wanted to talk about Tai Chi. So Tai Chi is another form of physical exercise. And actually, this I would say is pretty universally gentle and appropriate in terms of patients with neuropathy. So I wouldn't be as concerned about this as I would different forms of yoga. This is a practice for those who aren't familiar. There's a lot of slow movements, a lot of relaxation and balance. And this Tai Chi has been studied in the context of neuropathy and shown that regular practice, again, over a longer period of time, for example, at least months, can improve patients' walking, balance, strength, foot sensation, diabetic control, and again, they looked at nerve conduction velocity improvement as well. And again, I just want to emphasize that Tai Chi is absolutely a safe form of exercise for patients with peripheral neuropathy. MindBody Therapy. So MindBody Therapy, also known as biofeedback, is an extremely powerful tool for managing physical symptoms. This may help improve diabetes control, muscle tension, and anxiety. It's, the thing that's tricky, I think, about biofeedback is that it really takes partnering with an expert to get started with this. And so that can be a barrier for some individuals if it's not easy to find someone to work with, um, because it's important. It's a technique that actually has to be learned. So these treatments may include guided imagery sessions or relaxation techniques. Oftentimes, what you're doing is you're watching a monitor that is showing what your blood pressure and your pulse or other physiologic measurements are as you're using these techniques, such as guided imagery, to try to relax yourself and then result in a reduction in your pulse or a reduction in your blood pressure. And this really reinforces how emotion, pain, and stress influences our body and how these things are very interconnected. So this is a very powerful technique, but I think one of the things that's important is making sure that if you're trying this, that you're working with somebody and a setup that is adequate. Next, I want to talk about integrative therapy use in peripheral neuropathy patients. What do we mean by integrative therapy? Here I'm talking about anything that's not quote unquote traditional medicine. So sometimes we call this alternative medicine or complementary medicine, but what we do know for sure is that many patients are trying these techniques, and so it's important to be educated about them and to talk about them. There was a 2004 survey actually of 180 patients with peripheral neuropathy, and they found that almost half of patients that they surveyed had actually tried some of these integrative therapy approaches for treatment of their symptoms. And there's a list here of different things that people were trying. Some of them were trying high doses of vitamins, magnets, acupuncture, herbal remedies, chiropractic manipulation, and almost a third of patients thought that their neuropathy symptoms improved as a result. So this is very interesting. I will say that as a broad, stroke, we're going to talk about some of these different approaches individually and what some of the science is behind them and what some of the caveats are. One thing that I tend to say as a rule of thumb to patients is that if you're not being taken advantage of financially, if you're not spending money that you don't have on something like this, even if we don't know from a scientific perspective if it works, as long as it's not hurting you and you think that it's helping you, I think that, as long as we're fully educated, then it's fine, to continue with it. Everybody is different, and studies look at groups of people, but sometimes helping one individual patient, is not the same as reading a paper published about hundreds of patients necessarily. So I just want to keep an open mind, and let's go through and talk about some of these. So first, I'd like to talk about acupuncture. Acupuncture, I would have to say, compared to some of the other integrative medicine approaches, actually we have the most studies behind. Acupuncture has been studied for a number of different medical conditions and studied even through the lens of Western medicine. For certain things, it is shown not to be effective, but for pain, it actually has been shown in a number of different ways to definitely be effective. Is it a lasting, permanent cure for pain? Absolutely not. But many patients demonstrate improvements in pain, or again, I'm not sure how to explain it, but improvements in nerve conduction velocities were observed in some cases. And for some patients, they were actually over time able to reduce or stop their pain medications. I wanted to actually I am not affiliated with them at all, but I wanted to give an endorsement to the Pacific College of Health and Science, which is actually used to be called the Pacific College of Oriental Medicine, which is actually a US-based institution for acupuncture. They have branches in several cities across the country, and a lot of people are trained there. If you happen to live in a city where they have a location, they offer discounted, very affordable, and high quality acupuncture treatments at their institution. But one thing I would say across the board is it's important to make sure that the provider you're going to for acupuncture is certified and has undergone training. They should be able to tell you what their qualifications are, what their certification is. And that's important to know. Of course, it's important that the facility is hygienic, which at any reliable facility should be a given. And actually, interestingly, even a number of medical institutions now are offering for physicians acupuncture courses for treatment of certain conditions such as pain or even headaches. So again, this is something that people can try, and I think that for a number of patients, it may be very effective. It may require, again, multiple treatments, not just one, and cost for some patients can be a limitation, but again, it may be very much worth exploring. The next thing I want to talk about is a little more enigmatic in some ways, called bioelectromagnetics. So there's some body of literature which discusses that magnetic fields can penetrate the skin for a short distance and appear to target pain receptors in the skin. So there was actually a company called MagSteps, and they put together these insoles that are magnetic insoles you can wear in your shoes. They did a randomized trial where they found that some patients with diabetic neuropathy who wore these magnetic soles in their shoes for 4 months had a significant reduction in burning, numbness, tingling, and pain. So again, it's a little bit, in terms of looking at things through the lens of Western medicine, so to speak, it's a little mysterious, but I wanted to make sure we talk about it because it's an option. Certainly it's non-invasive. The risk in terms of the harm that can be done is there's really not that much harm. I don't know how much these cost, but I wanted to mention this because this is certainly something that people are talking about. The next thing that is a humongous field unto itself, and clearly this slide does not fully do it justice, but I want to mention it, is botanical medicines, and these include a number of different vitamins or other supplements. Many of these may be familiar to you as having kind of antioxidant or anti-inflammatory properties. And these are sometimes taken by patients or recommended for peripheral neuropathy. There are different studies about each of these individually that showed some varying degrees of benefits. A lot of the proposed pathways of efficacy from a physiologic standpoint for many of these revolve around their properties as antioxidants on the cellular level. One thing I want to mention about the B vitamins, it is kind of a little bit of a controversy in some medical circles because traditionally we really think of vitamin supplementation being effective for patients with neuropathy when they have a deficiency in those vitamins. And as part of the workup for neuropathy, your vitamin levels for some of these B vitamins, such as B1 and B12, should be checked. What we consider is that for patients who have normal levels, that in theory, extra B vitamins, if your levels are already normal, shouldn't be required. But there are some patients who find that taking extra helps them. That really doesn't quite match up with what we think of in traditional medical circles, but I just wanted to point out that it's out there. One important caveat, though, is that to think about when any of these agents can potentially pose a toxicity, or some of these botanicals potentially could have interactions with other medications that you're taking. That's where I think we cross the line and we have to say, you know what, it may not be worth it. So one small example I want to bring up is vitamin B6. Vitamin B6, actually, if you take too much of it, it can have a toxic effect where it can actually cause neuropathy. This is unusual. It doesn't happen with excess vitamin B1 or B12, but it's an example of how, for example, blindly taking mega doses of vitamins may not always be a good solution, and in some cases could potentially make things worse. Again, this is just to revisit some of the caveats about these different things that we've discussed. Again, I think that my personal perspective, because we have a lack of standardization for these modalities and botanicals in particular, or because some of these studies are very small for some of these integrative medicine approaches, it's really important to think about it individually with each patient, to look at sort of what their condition is, make sure that there's no harm being done, making sure that I never recommend that people expend sort of financial resources that they don't have on some of these sort of unproven or less proven interventions. And I think that anything that's a procedure-based treatment, whether it's something like acupuncture, you again really need to make sure that you're going to a provider that's very well trained. And so these are things to just consider when you're thinking about these things. It's very much a good opportunity to have discussions with your physicians about these options, and partnering with them as you're making decisions. This is a little related to that as we're talking about having conversations with your provider. I do want to talk about the importance of physician-patient communication, because I do see a number of neuropathy patients sometimes who have very challenging diagnoses, and we need to kind of rethink their medical workup and make sure nothing's being missed to try to uncover the exact diagnosis. But I will tell you, I definitely see a number of patients who the diagnosis is already known, but they're coming and looking for another doctor because they don't feel like communication is really that great with the one that they have. Or I think, in my personal opinion, kind of the worst is that some patients tell me they've been told, I can do nothing for you. And as we've just discussed here, that is just really not the case. There's always, in my opinion, I think a lot that we can look at in terms of what we can do to help patients with their symptoms. And I think that the right response is communication and continuity of care, meaning that, yes, if we know that you may have a neuropathy that maybe it's an idiopathic neuropathy, maybe there's no treatment and the workup has been done, if there are ongoing problematic symptoms that require ongoing monitoring and discussing how to treat it, that I think is an excellent reason to stay in communication and to set up follow-up appointments to continue this journey together. These are some interesting books. The Communication the Cleveland Clinic Way. Again, I have no connection with either of these books, but I think that they're just interesting books that talk about the importance of patient-physician communication. The other book, What Patients Say, What Doctors Hear, is an interesting anecdotal kind of read of a collection of stories about physician and patient communication, and how special a place that holds, both in terms of patient care and for the physicians themselves. So I think it's a fun read for those of you who might be interested. Lastly, I'd like to talk about some resources. Again, the one on the left is actually a book. The one on the right, sometimes you might see in a book format, but it is also available online in PDF form for free if you search for it. This really relates back to the idea of the importance of physical activity for helping maintain good strength, good balance, and endurance. Many patients go to physical therapy, which sometimes there is no substitution for physical therapy. But if you're sort of in a position where you're either supplementing with physical therapy, or you don't need physical therapy, but you feel like you'd like some extra tips and ways to get motivated to do exercises on your own, I think these are both excellent resources. The one on the right, Exercise and Physical Therapy, is really oriented toward, I would say, more older patients who are looking for kind of lower impact things, or activities that you can especially do on your own at home with even like cans of soup or a chair. The book on the left offers a wide range of options in terms of different types of exercises, looking at types of exercises to address different types of problems. So they have, for example, a segment including different stretches or strengthening exercises if you have low back pain. And they have another section that talks about certain things to focus on if you have balance problems, and so forth. So you can kind of pick and choose, but they often offer a range, and some of the regimens are actually much more physically challenging, I would say.
Shanna,
Yes.
um, I know you're going to give us a great plug here, but I wonder if we can jump a little bit and start having some questions answered, because we do have a few questions, and I don't want to not have time for those questions coming in.
Absolutely. Let's go ahead and jump right in. The book on the
Great.
left is just another resource for patients in case you're interested. I think it's a great book.
Yeah, and as I said, and then there's a great plug for us, so we always appreciate that.
Ab-
I want to thank you for all of the information you've shared. This has been terrific. We do have questions that have come in, and I've grouped them into some topics, so hopefully you can answer a few of these. We have really only about 10 or 12 minutes for questions, so I'll apologize ahead of time for those that we can't get to now, but we'll try to get to them later. Um,
Great.
One of the questions that came in is relating to symptoms. Can skin problems, psoriasis, be a symptom of peripheral neuropathy?
So that's a great question. So, and that's kind of there's a lot of different directions to go in that. So, psoriasis specifically is an autoimmune skin condition and is not connected itself to peripheral neuropathy. Now, what I will say is, I'm going to try not to make this too confusing. A lot of patients with skin conditions have different uncomfortable sensations, sometimes tingling or itching and so forth. And that can actually just be a symptom of the skin condition itself, and sort of like, that it's sensitive and it feels uncomfortable, and that results in uncomfortable sensations, but that patients with different types of skin or dermatologic conditions do not necessarily have peripheral neuropathy, including patients with psoriasis. However, that being said, what we also know is that for many patients who have peripheral neuropathy, let's say involving their feet, some of those patients, for example, may have diabetes. There may be other impediments to peripheral circulation. And many of those patients, we might see changes in the appearance of their skin, particularly over their feet, changes such as sometimes kind of a darkening of the skin a little bit, or a dry kind of appearance of the skin. And sometimes that's something that it's not that that is causing the neuropathy, but it sometimes is something that kind of goes hand in hand with the neuropathy because of the underlying causes of the neuropathy itself.
Okay, great. Um, what about the progression of symptoms? Will nerves regenerate? Will I get worse? What would you say to that?
So that's a really great question, and it's a tough question, but I think that we do have a lot of good data at this point that we can talk about. So what I would say is, of course, there are many different types of peripheral neuropathy. For some patients, they have a type of neuropathy that we know the treatment for, and occasionally we have a cure for. And for those patients, it's important to get that treatment. For example, patients with CIDP, or an autoimmune type of demyelinating neuropathy, they're treated often with IVIG, and that helps maintain and can help reverse their symptoms. So for those patients, that's important. Let's talk about patients, for example, with diabetic neuropathy. There were some studies which looked at patients with very early neuropathy from diabetes with sensory symptoms, and for some of these patients, again, in very strict studies, they put them on these extremely strict kind of lifestyle programs where they almost eliminated their diabetes, which is not always possible to do, of course. And for patients who suddenly had extremely good glycemic control, for some of those patients, they actually did see a reversal of their neuropathy, um, or if not a complete reversal, an improvement in their neuropathy. But I would say that for many patients, if you have something like diabetes, and even if you have a reversal in terms of the nerve conduction studies, you may still have pain and balance problems, almost like just kind of a chronic neuropathic symptom from having had that nerve injury to begin with. So there sometimes can be a mismatch between the symptoms and what the current state is. Sometimes it can feel like it's getting worse, when actually, when we look at how the nerves are functioning, it's not getting worse, but it just feels like it is. And that's something that they can see, for example, in patients who have a toxic effect from chemotherapy-related neuropathy. When we have patients with idiopathic neuropathy, meaning we don't know the cause, and it's been going on for some period of time, and the patient's had maybe very, very stable symptoms, or maybe very, very gradually progressive symptoms, there have been studies which have looked at those patients because it's a common scenario, and they found that for most of those patients, the future, the past, if you will, rather, kind of predicts the future. So if you have idiopathic neuropathy for a period of years and you've barely had any change in your condition, the chances are more likely than not that probably the same will hold truth for the future. For some patients, that's a source of comfort because it shows us that, for most of these patients, things are not suddenly going to spiral out of control and get significantly worse. But it can be, and sometimes kind of frustrating, but also instructive to say, this is really where we need to focus on managing your symptoms that you're having now so that you can live those years in the best way possible.
Okay, and I'm going to try to squeeze two more questions into the last 4 minutes that we have, or 5 minutes. The first one is, if someone is interested in medical marijuana or some of these other alternative treatments, who should they ask? Who should they go to ask about those?
So that's a really great question. Just to parse that out a little bit, medicinal cannabis or marijuana is actually legislated individually according to state. So not all states have legalized medicinal cannabis, and if you do live in a state where that's not available, then then it's actually not really possible to get unless you go somewhere else. And I can't really speak to that, but and it may be very complicated. For if you live in a state where it is legal for medicinal cannabis, then you need to find a provider who is certified to certify patients to receive medicinal cannabis. And you can find directory, at least in New York State, I can speak to. You can find usually directories of those providers online through the New York State website. Individual physicians, at least in New York State, have to undergo a certification to be able to certify patients for this. And then after you find that provider, then you are a patient of theirs, and then they go ahead and certify you to receive it, and then you go to a dispensary where you actually get it. Insurances often don't cover it. Actually, they really don't cover it, so it's an out-of-pocket cost. And each state, the process is different. So again, hopefully, at some point in the future, we will have a more standardized national situation, but right now we don't, and it makes it hard in some cases. For the other types of integrative medicine approaches that I mentioned, I think that talking in some cases to your neurologist can be helpful, or your primary care doctor. A lot of different for a lot of different medical conditions, things like acupuncture, things that we mentioned, are being promoted for across the board. And so your doctor might know more about this than you realize and be able to help make some recommendations. Otherwise, I
Great.
would say in conjunction with your provider, doing some targeted searches to find someone who can help you with this would be a good idea.
Great. And then what would you recommend to patients who have trouble with balance rather than pain, or
That's a
numbness rather than pain?
No, that's an excellent question. And I think, we don't want to let the focus on pain eclipse the importance of balance. So I would say it's a range. Usually, mostly it's physical activities and sort of mindfulness. On the one hand, wearing good supportive footwear with good traction is important. Not getting up and walking around in your house in the dark is important because that can put you at a fall risk. We always have to avoid falls. Being very careful if you're walking on uneven or slippery surfaces. If you have significant balance problems, physical therapy is a must. And if you have maybe more manageable, milder, intermittent balance problems, then I think some of these exercises, like we discussed, like Taichi, for example, or certain types of yoga, can be very beneficial.
And then in our last minute or a minute and a half, which is kind of probably not enough time to answer the question, but we'll ask this anyway. What do you see in the future? Is there new things coming up that might be helpful to patients that they should be talking to their doctors about now or going forward, or keeping an eye out for?
Well, I certainly think, this is a big question for sure. I would say that, I would say to separate it out a little bit, there's a lot of research that's ongoing constantly about treating underlying neuropathy, and that's separate. And there's a lot of different things that are looking at that right now. And I hope that we will know more and more as time goes by. In particular, I hope that we'll be able to carve away at this so-called idiopathic neuropathy as we find and identify new causes of neuropathy that we aren't currently aware of, so that we can treat them. Treating the symptoms is tricky. I think that pain in some ways, like we even looked at how many of these neuropathic pain treatments weren't even designed to treat neuropathic pain. I think we're still learning about pain a lot. And I think that as time goes by, we will have better and more elegant treatments for pain that have fewer side effects, fewer medication interactions, that are better and easier for our patients. So I think, this is a totally short answer to that could be a much longer
We
answer,
can have
but
a whole webinar just
we
based
could
on
have,
that, I
yeah,
suppose.
exactly, future directions. But I do think that we're going to continue to see progress in the years to come.
Terrific. Well, thank you, Shanna. Do you have any last words you would like to leave to our attendees and to our audience?
I just wanted to say thank you all so much for joining. And thank you, of course, to the Foundation for Peripheral Neuropathy. And I hope that each of you were able to find something in our discussion that speaks to you and that's helpful for you. And I wish you all a good evening.
Thank you very much. Shanna, I learned a lot, Dr. Patterson, and now I'm going to turn this over to Lindsay Colbert to close us out.
Thank you, Nancy. Thank you again, Dr. Patterson. We're extremely appreciative of your expertise. For the many questions that we haven't had a chance to address today, we will try our best to share some of those answers with you in the coming weeks through email. So please keep opening those messages from us and check our website for updates to stay in the loop. As Executive Director of the Foundation for Peripheral Neuropathy, I just want to reemphasize our desire to inform you, our patients, of the latest treatments and new updates that we think you'll find helpful in your management of this condition. And if you find these updates, and specifically today's webinar, helpful to that extent, I ask that you consider supporting us financially so that we can continue to serve you at the highest level. Thank you again for attending. We look forward to bringing you 3 more webinars this year on topics that we hope will bring you value. This concludes today's session. A recording will be made available in the next couple of days, so please stay tuned. And thank you again. Have a great rest of your day and evening.